Now for our final session of the morning, I'd like to invite Dave Brennan back to join me for a discussion about our key takeaways from today's session and how they support digital future for HTM. Hi, Dave. Welcome back.
Hey, Erin. Awesome session. Love it. Love it.
Great sessions. Amazing leaders.
Absolutely.
So Dave, what was your biggest takeaway from the keynote presentation with Phil and Mark, Sam, and Mike?
It was great. I actually took like 4 pages of notes, and I think we have 20 new webinar ideas from this session. It was great leadership, great display of creativity from them all. I don't know that I have one takeaway so much as I have a handful. I mean, I think it's worth noting Sam from McLaren kicked it off early with a great explanation of balancing needs, balancing your supply of your inventory with the true demands of your system, and looking for non-value added work. Really truly honing in on what has to be done was a great point, and then building that into long range plans that then get communicated effectively over a long period of time, repetitively, such that employees can get a sense of engagement. And this is a reason why we're not doing this kind of work. This is a reason why we've chosen to focus here. And I thought that was great. She gave a wonderful example of her defib analysis and how they really at the end of that analysis were able to reduce their defibs by 20%, both freeing up capacity from a PM perspective on her team, as well as putting a little bit of revenue back in their pocket. And then in no particular order, Mark Manning's discussion of clinically integrated HTM was fascinating. His department is partnered with a musculoskeletal radiologist director, and this doctor, who I think is Dr. Amrani, if I'm not mistaken, is partnered with Mark and the supply chain organization, which gives them an incredibly powerful trio when talking to other departments in the hospital, when talking to vendors, when analyzing data. They do it as a team, and I think that in and of itself is worth another series of discussions. I think that was fascinating.
Yep.
And then Mike.
Yeah,
Mike,
I also love.
Go ahead.
Oh, sorry. No, I was going to say I also love the focus on training and development. Both Mark and Sam talked about some ways in which they're focused on training and development. I loved the approach that Mayo is taking and partnering with some of the local colleges. Mm-hmm. So they're getting folks directly out of college to help solve for the retirement volume of employees that are close to retirement. And Sam had a great reference and resource in Amy. Sounds like she's helped build some of those tools. But focusing on developing and continuously assessing employees and team members, and that's important in any industry. But to have a tool that can help drive that sounds amazing. And so hopefully folks check that out through Amy.
Absolutely. That was brilliant. And then I would also highlight Mike Busticker's work smarter, not harder message, which I thought he gave a lot of great examples from refocusing on high risk mission critical assets rather than some of the small portable equipment which they could transfer to a depot solution and then free up that capacity for their OR or for their lab was brilliant. I thought many of the speakers this morning spoke about the usage of data, parts data from PartsSource, parts data from other vendors to help with their planning, whether it's centralized stocking or otherwise. I loved Sam's comment about her analysis and really just determining what you're not going to do and what you're not going to focus on. And it's a really powerful message to a group of people who are largely tasked with managing an incredible number of assets with incredibly few people and have ever increasing demands upon them. I thought it was brilliant. So thank you again to all of those speakers in the first session. It was a really great session.
That was a great session. On the note of data, Dave, you were the moderator for the real world challenges and solutions with Ed and Sharon and Larry. How do you think that data plays a role in overcoming some of those challenges and creating solutions?
Yeah, it's a great question, and that was a great session, and it's important to note that they weren't on the field, so to speak, with the other players in the first session, right? They were in the green room, they were in the locker room, they were waiting to go on for their webinar, so they didn't get the benefit of actually talking or hearing some of the discussion, and yet some of the same themes came up around the leverage of leveraging data, giving yourself flexible options, building long-term plans, making sure you have contingency plans. I thought, Larry's use of the word optimization and giving yourself options around optimizing your team, and the equation around optimizing your team was a critical one. And then to your point around data and metrics, it came up in multiple ways. I loved the fact that Sharon from Mantis Medical, a service provider, really hit it head on, saying, I want the feedback, I want the continuous improvement, I want the measurements for my team, I want the ability to drive continuous improvement across my organization, and that the measurements will drive better outcomes.
Right.
And the same sort of capacity discussion, Ed from Kaleida mentioned that he doesn't have the luxury of an AEM program. He doesn't have that. He has to go through each PM procedure in the state of New York. So he really needs that flexibility that we're talking about in the use of external labor solutions, which brings us to our last topic.
Yep. Yeah, the service session was great, exciting solutions. And, here at PartsSource, we are always focused on continuous improvement, but really driving and evolving our solutions based on customer demand. So we always want to be ahead of the curve as much as possible, solving those problems and being proactive. But since so much of our development and design and our programs are developed around those customer challenges, what have you seen, through your product team and working with customers? What changes have customers and hospitals been demanding that has evolved the services strategy and the solution that we created?
Yeah, I mean, I think it's a great question, and I think that it's a host of things that really add up to inefficiencies and variability within the time and materials space, or the on-demand space, that ultimately end up costing money and time and delivering poorer quality, less quality solutions than the industry deserves. Our customers have been very clear about the time wasted in sourcing these events, the time wasted in chasing field service reports and good documentation, the variability of the documentation that shows up during their audits. And like most things, you can't control what you don't measure. And if we're not measuring the on-site behavior of technicians, if we're not delivering clear, consistent, multi-vendor reporting that is objective, we can't hope to help our clinical partners drive better outcomes. We certainly can't hope to help our supply side partners build better programs of service and really know where they need to shore up their operations. So super excited to announce that. I think Scott did a great job of walking through the solution, which is really going to benefit OEMs. It's going to benefit ISOs. It's going to benefit the healthcare provider community by providing standard approaches to what has been a very non-standardized area of spend for HTM teams.
Yep. Yeah, on the note of on-site service, we had a question, and while we can't answer all the questions that were posed today, we'll make sure to follow up with folks that answered questions that we can't cover. But just to make sure we can cover at least one of them, Dave, and on the note of service, there was a question about how on-site service works with our PartsSource Pro program. So PartsSource Pro, for those of you that aren't aware, is a program that we offer hospitals in order to consolidate, provide not only cost savings, but time savings, and a lot of value through data and insight in consolidating those procurement activities. So, in the context of PartsSource Pro, the question was, how does on-site service work with that program? Does it work with that program? Do you want to provide some insight on that?
Sure. Great question. So I would start with saying it's that community of pro clients that collaborated on the design of the product, and as consumers of on-demand service or on-site service from PartsSource, they get preferred pricing through the program. That's the primary benefit that they receive. And frankly, what they're looking at is they're looking at, how do I do this on a fleet basis? How do I do this on an enterprise basis? How do I look at this service as a way of freeing up time, freeing up capacity, and thinking about it as sort of a dispatch as a service model, and dispatch as a service that means I'm no longer sourcing, I'm no longer chasing, I'm no longer wondering where all my children are, if you will, as a radiology director, and we now do that for them. But the primary advantage is preferred pricing for pro versus a non-pro member. So it's yet another reason to join the pro community.
Yep, and there's another idea, something to help us track our children.
Exactly.
I can relate to that one. Well, at this point it's 1 o'clock, so we want to thank everyone for joining us for such a great morning of insight, collaboration, innovation, and amazing HTM leaders.